Hi! I realized that I haven't introduced myself in any of the videos, so I will go ahead and do that now. My name is Grishelle Pellizzari, and I am an LMFT. That means I'm a licensed marriage and family therapist. I'm also a PhD student working for my clinical psychology degree. So today, somebody requested that I discuss OCD. So that is obsessive-compulsive disorder. With OCD, we tend to have two features. This is obsessions and compulsions. With obsessions, this is where people kind of get stuck with intrusive, repetitive, and distressing thoughts, images, and impulses. We all have these bothersome thoughts and worries. That's normal, okay? What separates a obsession is that these thoughts won't go away. These thoughts, you become preoccupied with it and you're unable to shut it down no matter what you do. Most of the time they're unrealistic and they don't make any sense. So you have no control over it. It kind of takes over your life, right? So in order to kind of minimize them, shut down a little bit in some kind of sense that you feel control and order in your life, we create a compulsion. The compulsion is a way to just de-stress and relieve the anxiety that's created by the obsession. This can be done in either covert ways, which means hidden, or overt ways, which means observable, out in the open. And people with OCD, we tend to have to perform a compulsion in order to de-stress and minimize the obsession. But first, before I talk about compulsions, I'll kind of discuss certain obsessions or common obsessions that are observable out, in the psychiatric world. So we notice a lot of ordering. So this is a fear of getting a negative consequence for when things aren't done just the right way. So if it's out of order, holy smokes, it's a no bueno. And then we have doubting. So this is a fear of making a mistake or doing something wrong. We have aggression, so that's a fear of either hurting yourself or hurting somebody else or somebody hurting you. There's also a fear of contamination, so that's fear of germs. It's a big one. I see that one a lot. And then there's a fear of unwanted sexual thoughts and urges. So those things keep popping in our head. Those are a few of the common obsessive thoughts with OCD. Now, going back to compulsions, several of the common ones would be, now remember, they relate to the obsessions, okay? So some of the common compulsions are going to be cleaning and washing. They're trying to avoid contamination and contaminated objects. So with the fear of germs, obviously. And then there's checking. So with this one, I see a lot of, they're checking the route. So if they're driving somewhere, they want to make sure that everything's okay. Locks. Make sure that they're locked, so they're going to go back and check it multiple times. Rereading something to make sure that it's been proofread multiple times too. Same thing with writing documentation, so if you're like doing homework. Ordering and arranging. This one, perfectly lined clothing by color, shape, size. So all your t-shirts are in one area, all your pants are in another, dresses. I also see this with like kitchens. Has to be done. Cans, boxes, Tupperware containers. Yeah, very organized. Another kind of compulsion is going to be mental rituals. So a lot of counting. So they have to count to a certain number or praying repeatedly. Now the compulsions are done to help reduce and eliminate the stress and the anxiety that's brought on by the obsessive thoughts. So yesterday I was discussing the body dysmorphic disorder, and it's a part of the family of OCD, right? So we obsess over imperfections and flaws. So we create a compulsion, a routine to minimize those obsessive thoughts. So it's either constantly checking and things like that. So remember, everything kind of fits in line. So yeah, if you have any questions, let me know. There's so much more. I'm just not going to dive into everything. I'm going to give you little small tidbits of each thing. So If you do have questions, if you do have thoughts, concerns, or any other suggestions, just let me know. All right, have a great day. Bye.